So hi everybody, my name's Emily Henry-Farncombe and I joined as a health equity research advocate in March 2025. It's been a fantastic experience. I'm also a senior research leader at UHMBT. So having this group has been brilliant for me to be able to touch base with everybody and really think about implementing that equity lens across my organisation. Are you okay to move on?
Yeah.
Trina, thank you.
It will eventually.
Thank you. So the health equity research advocates, what's offered when you do the training? So you have a training program and you attend with your manager. And the reason you attend with your line manager is often we go on these courses or events, and actually it's really hard then to bring that back to your organisation and have those conversations. So going together is a really powerful way of taking this forward. Like Katerina said, we've got some fantastic resources, so being able to tap into those resources and really understand what they mean, and also just have a refresh of those concepts, because it is quite confusing language and it is used interchangeably in different parts of the world as well. So revisiting that together as one and getting that language right is important. The network is essential, and for me, networking with people across different disciplines, different organisations, but then also seeing the commonality of those challenges that seem to be faced everywhere you go. Once you get together, that's when those sparks fly and you start having those ideas and you think, okay, how can we overcome these challenges if someone's tackled it in a certain way in another area? Again, that's those cross-sector connections that you can build up those relationships, share resources, or maybe do something together from a research perspective. We do have individual objectives, but these aren't transactional objectives. I think we're all probably swamped with objectives and spreadsheets and things that we need to do in our day job. And this isn't about adding that. It's about thinking differently, approaching things differently, stopping and reflecting and having that time, which we just don't have time to do in our normal day-to-day lives. And that's where our solutions come when we get that opportunity. Are you okay to move on? So this is a very important slide. When we get together, so we get together once a quarter. So you do your training session. I think was it one day, Catherine? I can't remember.
Yeah, one full day.
One full day, and then you get together quarterly, which does come around fairly quickly. And like everything, oh, have I got time to go? I've got too much on my plate at the moment. But I tell you what, it is worthwhile. And you really come back with new ideas and solutions about what you want to do. We've had some really interesting different guest speakers. One of these photos here is Neve, who is was doing her PhD, and she's produced a fantastic infographic on this topic, which is really good to see. And actually since then I've linked with Neve, and she's been working on a research project and advising us since on how we can tackle that through an equity lens. So again, really positive. Everybody bakes cakes, particularly Katerina, and brings and shares food, and we have a real nice kind of lunchtime together, because again, building up that network and relationship is what's really important to take things forward. You okay to move on? So from my perspective, I kind of came away thinking, well, you know, it's more than an equality impact assessment. I'm sure everybody here spends a lot of time filling in equality impact assessments, especially if we're doing a service change, etc. But it's about taking that back into your organisation, about being curious and questioning and having those reflective discussions, and taking those discussions into places where equity normally isn't talked about. So into areas such as finance. It's also about thinking about intersectionality, and I'll tell you what, that doesn't come up in an equality impact assessment, but you know, what does that really mean for people, for different groups when you combine all of that, and what impact does it have in terms of discrimination, etc. And then how do we unpick those complex institutional systems where there might be hidden discrimination? And we've probably all seen that in our workplace, and that's about stepping back and thinking differently. A key thing that's come up recently that we've talked about on the last couple of events is about speaking the language. So I'm sure everyone on this call is probably challenged by finance and ops kind of taking centre stage at the moment because of the financial challenges of our organisations. So we've talked about, well, actually, how do we speak their language and bring this in? So we brought an expert from health economics into our session this week, and so we could talk about it in that respect, and then bring that back into our organisation again. We talked about being a compassionate disruptor the other day, because actually, if we all say yes to everything and just go with the flow, and no one's standing back to really think about that impact to our patients, our community, our service users, then we're not doing our job right from that respect. So a compassionate disruptor, I'm happy to kind of hold that title at the moment. And especially when finance is speaking so strongly, if we've got the right language to take that forward, that's really important. So my growth, I've definitely grown as a leader in this space. And again, that's networking, discussing, sharing, listening, and thinking about things across the system. And particularly from a political perspective, it was really interesting hearing about one of our colleagues who was working in an area where reform were part of that county council and what impact that was having, and really thinking about our politics and how that's shaping things going forward. From a live examples perspective, since being in this programme, we've now got patients and public involved in our research committee. We've got 10 homegrown research projects, and we've really thought about these from a health equity lens. So as things come through, we're stopping and checking them before that we give them the green light to go on. We're challenging the status quo, and we don't want to have duplication, and we don't want research to be done that just sits on a shelf and doesn't have an impact. We want it to really tackle those health inequalities and get to the causes of the causes, so we're really getting to that justice position. And then finally, it's about embedding it into our organisation. So this is a bit of, you can move on, Katrina, that's fine.
Sure.
Yeah. So this final slide, we talk about 4 quadrants, so patients, workforce, performance, and finance. So this is about talking about that, using the right language so people can really hear us. So what money can we bring in by doing this? If we're thinking about it from a health economics perspective, actually, if we're doing this and we need to turn something off and we're turning another project on, what impact is that going to have? And have we really done a good evaluation of that in terms of the research and the impact on our community? I won't talk about all of this slide, but this is what we've shared with our CEO and our organisation to say this is how we're going to bring it into that area. And then on the final slide, so this is how to get involved. Nominations are open now, aren't they, Katerina? Do you want to say anything else about how to get involved? I'm happy to talk to anyone about my experience. Please just drop me a message and I'm happy to have a link up.
Yeah, same. Happy to be reached out to with questions, and it's a nomination form. I'll put the links in the chat as well. We're just asking whoever's going to have the managerial responsibility for advocates, and you may have one in your organisation, you may choose to have more. We don't limit that. That's fine, to just fill out that form and nominate people.
Thank you.